So we have people from all across the country, which is amazing. And I know we have people who are overseas as well. Once again, thank you for joining us for our Cancer Awareness Week special. Um, we plan on doing a special topic for a full week deep dive once a month. So we will pick 1 week each month and do a deep dive onto whatever topic we choose. I do know February's topic is going to be dental health and dental care because February is Pet Dental Health Month. I know we have in the works a kidney disease week and a heart disease week. I'm sure there will be lots of ideas for other things. I know allergies and IBD are huge topics. They just make me crazy because because it's such a huge topic. Anyway, so yesterday we talked about signs and symptoms to be aware of for whether your pet might be brewing something sinister somewhere inside or on the body, and what to look for. And today we're going to talk about diagnostics. And I'm going to talk about screening tests as well as actual diagnostic tests. And certainly I can't cover every single test that's available. And I'm sure there are tests out there that I'm not even aware of yet because new things are coming on board all the time. And at the end of the week, we will be putting together a blog with links to a lot of the stuff that we're talking about this week. So you can take notes if you want to. You can go back and listen to the videos. They will stay live on our Facebook page. They'll also be posted on the YouTube page. And hopefully today Instagram will continue to run. Yesterday it just didn't want to do it. So in my practice, one of the things that we push, because we were a more holistic practice, we were integrated. And so it wasn't about pushing vaccines in our clinic, and it wasn't about pushing medications in our clinic, but it was about pushing really good preventative care and being proactive and doing diagnostic testing and doing it quite often so that we could be aware early if we started seeing changes in our lab work. So I strongly recommend if you have a young animal that you get a complete blood panel at least once a year. And if you have a middle-aged or older animal, that you increase that frequency. So for our 7 to 10-year-old kids, we probably should be doing at least twice a year lab work. And for the seniors, I would up that to 3 or 4 times a year, because the earlier you catch things, the more you can do, the sooner you can be proactive about making changes that might be necessary in order to keep them healthy longer. So, and certainly if your pet is not feeling well, you're noticing any of those things that we talked about yesterday, and we have an acronym in veterinary practice called ADR, just ain't doing right. So if you have a pet who just seems to be just not quite up to where they should be, they're not acting as vibrant as they were, get them in, get them checked, and let's get some lab work. So what are we going to ask for? We want a CBC, which is a complete blood count. Things that we might see with cancers, we might see elevated platelets that indicate inflammation. We might see elevated white blood cells that indicate inflammation. And when we see that, we have to be able to know the difference, whether it's an infection versus inflammation. Your veterinarian should be able to figure that out, but I see one of the things that we'll go into in depth in the lab course that we should have coming out in the next couple of weeks, so that you can tell that. And so we're also looking at our red blood cell count, we're looking at our hemoglobin. So the CBC gives you a ton of information. Then we're also going to want a complete chemistry screen. And unfortunately, a lot of times we'll end up with kind of a mini screen that doesn't give us as much information, particularly in our senior animals, or if we're trying to track down something sinister that's going on. We want that, what we call a supercam, or a complete blood panel, not just the mini screen. So we want to see liver function, kidney function, electrolytes, minerals, blood sugar. We want to see what the pancreas is doing, we want to see all the organs as much as possible. Now, there are some organs that don't have markers. The spleen doesn't have blood markers on a regular blood panel. So it is very common to have animals with cancers in their spleen or in their bowel that they have perfectly normal lab work. So while the lab work can give us clues, it is not always diagnostic for a cancer. We also include on that lab work a urinalysis. The urinalysis gives you so much information about kidney function, whether there's blood in the urine, whether it's red cells, white cells, whether there's infection, crystals, something called CAS. The urinalysis will give you a ton of information, so make sure you take that urine sample with you and include a stool sample. The stool sample, generally, they're just going to look for parasites, but they also can do testing for occult blood. So if we think that there might be something going on in the bowel, we might want to be testing for undigested muscle fibers, undigested fat, occult blood, and look for things that are a little out of ordinary in the stool sample. So particularly if you really think there's something going on and you want to get that tracked down. So for masses on the exterior of the body, things that you can see, we have a couple of options. If the mass has broken through the skin at all, then your veterinarian can do something called an impression smear. Basically, they take a microscope slide, press it up against the mass where it's ulcerated, and then they can dry that, stain it, look under the microscope, and look at the cells that are coming off the top of that ulcerated mass. So we can diagnose mast cell tumors, spindle cell tumors, hey little buddy, melanomas, all kinds of things, just by doing that simple impression smear in the office. And veterinarians are not pathologists. Your general practitioner is not a pathologist, so they may not be able to tell you exactly what that cell is, but they certainly can tell a normal cell from an abnormal cell, and then those slides can also be sent out to a pathologist to look at. You can also, if it's a mass that has not broken through the skin, they can do something called a fine needle aspirate. We can also do fine needle aspirates of the liver or the spleen using ultrasound. We can do that with an ultrasound guide. So a fine needle aspirate is basically taking a syringe with a decent sized needle on it, sticking it in the mass, sucking back, getting some cells in the syringe, again, putting them on a slide, staining it, looking under the microscope, or sending it out for evaluation by a pathologist. So a fine needle aspirate can be very telling, even on a mass that is under the skin. You can feel it, you can maybe see it, but it's not broken through. Certainly, if we have a mass that we're suspicious, so a lot of times the fine needle aspirate will be your first thing that you'll do to say, is this a benign or a malignant mass? So certainly lipomas, most of the big fatty masses, most of those are benign. 99.5% of those are benign. So it's worth getting a fine needle aspirate. If that's all we see is a bunch of fat cells and it looks benign, then we don't necessarily have to go further and get a biopsy. And whether or not you remove it is up to you and your veterinarian and what you think is best for your particular animal. If we see, so let's say we do an impression smear or a fine needle aspirate and we go, ooh, daggone it, there's some nasty looking cells in there. We've got things that don't look healthy. That would then lead us to say, okay, do we need to get a biopsy? Can we try to remove this entire mass? And it would depend on what the mass looks like. So for instance, a mast cell tumor, we would try to get that entire mass off and we would try to get nice, big, clean margins so that we don't have to do the surgery twice. Because if we do little tiny margins around a mast cell tumor and it does come back as a mast cell, then 9 times out of 10, they're going to want to go back and do a second surgery and get bigger, deeper margins. Sometimes that's not possible if the mass is on a leg or a tail. That was why Gwen had Mila's tail amputated, because the mass was big enough that there would not be enough skin to close over the hole if they really did a wide excision around it. So it was better to just give her a nubby tail instead of a long tail. It worked out fine. But that's certainly going to depend on where it's located. So one of the things that is a really good idea, and I'm going to give you the website for this. It's drsuecancervet.com. and she has these body maps. And there's one for cat, one for dog. Now, another thing that you could do is you could, and there's her website, drsuecancervet.com. One thing that you could do is you could just take pictures of your animal from these different positions, top, bottom, and both sides, maybe from the back and from the front. And you can, and I've had a lot of clients who would do this. They would map out every mass that they felt. And then the other thing that you can do, this is also on Dr. Sue Cancer Vet website, which I thought was really cool, is this. It's called a caliper pen. Now she has regular calipers as well, but the caliper pen, this is a little slide that goes back and forth, and so you can measure how big the mass is. Basically, you put these two little slides on either side of the mass, and then it's got a measurement there. So it's a good idea if you're feeling or seeing masses to measure them and mark them on your body map, and do that weekly, monthly, so that you can see if they're growing and keep track of them. And certainly if they are growing, then that's time to go and get them looked at more closely. For cancers that we think we might have internally that we can't see from the outside, maybe our lab work is pushing us in a certain direction where it's like, oh geez, those liver enzymes are looking really bad, we need to know what's going on there. Then the next step would be to get some imaging, and that could be x-rays, could end up being an ultrasound, and we could end up with a CT or an MRI, so depending on where we think the mass is. Certainly for some breeds that are more prone to cancers, for instance, golden retrievers, Rottweilers, they're really high on that list for hemangiosarcoma. Our Bernese Mountain Dogs are very high on the list for histiocytic sarcomas. Doing screening ultrasounds or screening imaging every 6 to 12 months, once the Bernese, they're getting these cancers as young as 3 years old. So doing screening testing for them, while it's expensive, you may catch something earlier than waiting until we have a ruptured hemangiosarcoma. So you can use imaging as just part of your routine visit once a year. You can say, can we just get an x-ray and let me see what his spleen feels like or looks like? Let's see what the liver shadow looks like. If the x-rays look abnormal, you could move on to an ultrasound, or you could just start with an ultrasound. So that's up to you. Then we have some newer cancer testing. So one of the ones that, it's been around for a little while, but it's done by Antech Lab. I don't know if other labs do it or not, but it's called a Cadet-Braf, CADET-BRAF. And it's a urine sample, and it tests for transitional cell carcinoma. We can get false positives on it. I did have a false positive on a case once, and I was really happy when she came back and said, nope, went to the internal medicine specialist, did a bunch of other testing, and no, we don't have the cancer. It was a false positive, so that was a good thing. But it's a simple urine test. If you're suspicious of transitional cell carcinoma in the bladder, which is most common in Scotties, by the way, then that test can be very helpful, along with imaging, usually ultrasound. So that is one specialized test. Then we have a couple of others. There's one fairly new test called a NuQ, N-U-Q. It's run at Texas A&M Veterinary College, at Texas A&M University Veterinary School. So they say there's an estimated 6 million pets diagnosed with cancer each year. It's a high number, guys. Earlier detection of cancer not only can help save lives, it can also improve the quality of the life of the dogs and more quality time with its owner. This one is a dog test. I'm going to talk about some cat tests in a minute. Currently, many dogs are only diagnosed when they are unwell and there's a suspicion of cancer. So then we go through this whole process. But they're marketing this test not only for diagnosis, but also as a screening test. So kind of nice. So it's a blood test that you can ask your veterinarian for, and they send it off to Texas A&M. And they're recommending it be used with the annual wellness check for dogs 7 years and older, or for cases where there's a high suspicion of cancer. It also may be a complementary test for younger dogs at high risk for developing cancer in their lifetime, such as golden retrievers, boxers, flat-coated retrievers, beagles, Bernese mountain dogs, Rottweilers, West Highland white terriers, and Shelties as they age. The Nu-Q Vet cancer screening test has been shown to detect lymphoma and hemangiosarcoma. It's very high efficacy at detecting those. And those make up approximately 1/3 of canine cancers. So that's kind of a good deal. But they said that it may also be used to detect histiocytic sarcomas and mast cell cancer stage 2, not the stage 1 disease. So if it's a little bit more advanced. So they're still working with this test, but it's a pretty good screening test for these particular breeds. And it can be used for telling how well treatments are working and that sort of thing as well. So pretty excited about that one. Now, there's another lab called VDI Laboratory. So they have a bunch of different ones, and I'm going to talk about each of them individually. And these can be used for screening or for diagnosis. I'm going to have to go slap Stewie in a minute. So they have a canine cancer panel, and it's 2 blood tests that they use, and they can detect cancer in a variety of different tumor types in dogs. We'll talk about the cats in a minute. This can be used as a first-step diagnosis prior to or in place of a biopsy to be sure that a cancer is present before you put the animal through a biopsy. So common applications for the canine cancer panel from VDI: lymphoma, abdominal masses that you're not sure whether it's cancer or not, solid tumors, stage 2 mast cell, the ADR dog ain't doing right, hypercalcemia of malignancy. So if we get our lab work performed and we have a calcium level that is really high, a lot of times that goes along with a cancer. So this testing can help detect what's going on. It can be tested for used for testing for metastatic disease as well. It is not recommended for skin masses, stage 1 mast cell tumors, or brain tumors because they're not going to have the same markers. So the reports include TK1. TK1 is an enzyme responsible for the production of thymidine during cell division. And it's a proliferation marker of dysregulated replication. Remember we talked yesterday that cancer cells just divide and produce like crazy, and they don't follow the rules, and the body can't turn them off. So that's a hallmark of cancer, and that's what TK1 is measuring. And in lymphoma and lymphosarcoma in particular, TK1 values get really, really high. So the next test that is included in this profile is a C-reactive protein. Cancer is an inflammatory disease, and when inflammation is present, cancer might be the cause of that inflammation. So the major systemic marker of inflammation in dogs is C-reactive protein. It's an acute phase protein produced by the liver in response to acute phase reactants such as cytokines and interleukins. So that's the scientific explanation of it, that basically it is measuring inflammatory markers in the body, the C-reactive protein. And if both the TK1 and the C-reactive protein are high, there is a huge likelihood that there's a malignancy somewhere, and you know that you need to be searching it out. So chronic inflammation initiates and impacts all major stages of tumor progression, from cell transformation to widespread metastasis or spread of the cancer. All right, so let me get to my next page. Then they also do a pericardial effusion panel, and they're basically looking at the TK1, but they are testing not only the blood, but the pericardial effusion. So pericardial effusion is fluid that collects in the sac that holds the heart. We just had a dog last week that had pericardial effusion. They tapped the fluid from around the heart. It wasn't sent out for testing. It would have been nice if it had been. Because we need to know, is that fluid there because we've got a heart failure issue, a heart a primary heart problem, or is it there because there might be a hemangiosarcoma or other tumor that is on the heart? So by testing the fluid from around the heart as well as the blood, it can give you an answer to that. All right, so let's talk about kitty cats. The same lab, VDI Laboratory, has a feline gastrointestinal lymphoma panel. And it uses 4 different markers to diagnose lymphosarcoma in kitty cats. So cats are notorious for GI inflammatory disease. It continues to be one of the hardest determinations to decide, is it IBD or is it lymphoma? So applications for this would be a cat that we're looking for GI lymphoma, that has chronic progressive IBD, the ADR cat, the one who's not doing well, and also for chemotherapy management. So if you have a cat that's been diagnosed with GI lymphoma and you want to know how well the treatment is going, you can do this test and it'll tell you where those inflammatory markers are so that you know how well your therapy is working. And so in that, we get 4 things. We get B12 tested, folate testing, HPT, let's see what HPT is, and TK1. So again, a simple blood test that can be sent out to VDI labs. And let's see, they have a feline cancer panel, which is used as a first step diagnosis prior to or in place of the biopsy. So really good idea. So again, on that one, it can detect solid tumors. The ADR cat can be used for the GI lymphoma. It's going to give us a TK1 and an HPT. And I think, they also do an equine lymphoma. So if you think that there might be lymphoma in your horses, they do that TK1 test for horses as well. Okay, so, and if you're just doing screening on your dog and your cat and you aren't sure whether or not they've got a cancer going on, maybe they're one of those breeds that is highly likely to develop a cancer, they do a cancer risk assessment, and that's the TK1 and CRP, and then they put it on a little scale of 0 to 10. And depending on where your pet falls on that score, it tells you, for Instagram, where they fall on that score, it gives you the likelihood that they could be developing a cancer. And that one they recommend as part of the annual or biannual workup of dogs, particularly those at high risk of developing cancer. And their cancer risk assessment can be added to any wellness panel offered by the Veterinary Diagnostic or the VDI labs. One of the ones that we have in our web store is the vitamin D test kit. But in that test kit, you can opt for these other tests as well. You can have them as an add-on. So they recommend cancer risk assessment testing for apparently healthy dogs during annual wellness visits over the age of 5. High-risk breeds, the golden retrievers, the list that we already gave, Bernese Mountain Dogs for sure. Dogs with a history of cancer in their line. So if the parents have cancer, the siblings have cancer, if you know your breeder and can keep track of other pets in the line. They're saying for the best outcome, the cancer risk assessment score should be evaluated every 4 months, particularly in those older dogs like we talked about. 6 months is a good compromise, as 82% of cancers in the study were detected 6 months prior to clinical signs. So that is huge. Knowing that your pet is brewing something 6 months. Hemangiosarcoma in the spleen when it's this big, it hasn't ruptured, your dog's not bleeding out, he doesn't have metastasis to his chest, that's a good time to find out that you have something going on. So they say annual testing at a minimum. Anything beyond 6 months does not hold statistical value and is not included in the risk assessment. So they really like to have them done every 6 months. And again, you're looking at trends with these. So screening is for the apparently healthy, clinically normal dog. It is used to detect occult or early disease that hasn't really had time to cause any visible problems. And like I said, they do a cat one as well. So I think that these screening tests, and like I said, I'm sure there are others out there that I'm not aware of, but these screening tests are really important. And if your veterinarian is not familiar with them, you can go to the website for VDI Labs. You can go to the Texas A&M University website. Just type in NUQ, N-U-Q, and you'll get your answers. Okay, everybody have a wonderful day. Tomorrow we will be discussing cancer from a TCVM perspective, which is the Chinese medicine perspective. We'll talk a little bit about food and move on through our week. Remember, on Friday morning we have a special guest, and that special guest is going to talk to us about prevention of cancer, because yesterday we talked about a lot of the different causes of cancers, and like some people brought up, how do you avoid all those things? How do you detox your dog from the environmental toxins, environmental pollution, things, electromagnetic fields, things that we may not have a lot of control over. So I'm looking forward to that as well. I'm sure that we will all learn something. So everyone have a wonderful day. And let's see if I can get a little bit of music to get us out of here for the day. Stewie finally got quiet when we're, approaching done. Little stinker.